Good morning, everyone. My name is Amy, and I work for the My World of Work Live team within Skills Development Scotland. It's our job to help you understand about future careers in Scotland and what skills are going to be needed for those roles. So today I am hosting the virtual Meet the Expert session with Francis and Diane from Public Health Scotland. I'd encourage you to get as involved as possible. You can ask questions anonymously by the Q&A box to the right of your screen. If you do not wish to take part, that is absolutely fine, but the session will be recorded for any young people that can't make it today. The session will be uploaded to the My World of Work YouTube channel, so you can go back and rewatch anything that we've spoke about. So today I'm going to be covering a quick overview of the healthcare sector. Then I'm going to introduce you to today's experts, and you'll listen to their career journeys and have the opportunity to ask any questions. So without further ado, let's talk about the healthcare sector. So the healthcare industry now is the largest in Scotland. Over 400,000 people work in the healthcare industry. That's over 15% of all Scottish employment that is in the healthcare. However, there were over 5,000 vacancies last year, and most of these vacancies are due to skills shortages. So that's 24%, so almost a quarter of all vacancies are due to people not having the right skills or not having enough skills in certain areas. And this is because the future of healthcare is becoming more and more digitalised. So in the next 10 years, there'll be almost 80,000 jobs required to replace the demand of an ageing workforce. And the top 5 jobs that will be available will be carers, nurses, therapists, medical practitioners, and public health professionals, much like our experts today. So we're very lucky to have them. So I'm going to introduce you to our experts today. We have Francis, who is a health improvement manager. So she has studied public health and stayed in public health and has worked in a variety of areas. And we also have Diane Clayton, who is a learning and development manager. And Diane started in zoology and has worked in various sectors and found herself also in public health. And we're going to hear a little bit about their career journeys and what they do for a job. So we're going to hear from Francis first and then Diane. So Francis, would you like to speak to us a bit about your career journey? You're on mute.
There we go. Sorry about that. I'm a health improvement manager in Public Health Scotland. Public Health Scotland is the lead national agency for improving and protecting the health and well-being of all people in Scotland. I didn't see my career path, this specific role in my career path, but I've more evolved into it. I studied nutrition at university and then got my first job working to improve the nutritional content of school meals and food in schools. This job was actually through a council rather than the NHS board. I worked with pupils and teachers and parents, as well as other professionals, to promote the importance of good food. An example of this work was linking with pupil councils to hear what pupils wanted, and then liaising with schools and contractors to make various changes. So that could have been the look and the feel of the dining room, the queuing systems, and the food served. After this role, I then undertook health promotion in schools, encouraging teachers and pupils to think about what health was and the importance of including health in all aspects of school life. Things like maybe having adequate water available, thinking about mental health. And then I moved into the NHS and have worked in various kind of health improvement roles there. So one was around kind of health improvement in schools. And again, I was out visiting schools and working with staff around that. And then I moved into NHS Health Scotland and worked in and around the diet and healthy weight team. So this role involved networking people across Scotland in and around food and working with various projects linked to policy and practice. So policy provided by Scottish Government and the practical work undertaken by colleagues in NHS boards in particular. So in that role, I provided lectures to university students, attended conferences, chaired kind of networks around food and health with colleagues across Scotland, wrote and reviewed resources and helped kind of, I suppose, integrate policy and practice. And another role I've recently had was looking at empowering communities to make changes to support their own health. So this was working in and around kind of community development, and again working with a variety of different organisations and professionals looking at supporting health in communities. So whilst working in NHS Health Scotland, I undertook my Masters in Public Health. So that's kind of provided me with a greater understanding of all aspects of public health. And then in the last few months, I've actually been supporting work on screening and immunisation, and specifically looking at work around flu and COVID vaccination programme, and making sure that the different populations who are eligible for these programmes can make an informed decision about getting the vaccination. So within, I suppose, public health and within the role that I'm doing now, there are loads of different roles that you can do. You can be working in diet and healthy weight, physical activity, drugs and alcohol, mental health, screening awareness, screening and immunisation, just to kind of mention a few. Each route into, I suppose, the work is very different. So everybody's route in has been different. You don't have a set career path to follow. For example, some of my colleagues have maybe worked and trained in nursing or in a medical kind of route. Others have kind of come in from a kind of community development background. Obviously, I explained that I came in from kind of nutrition. The work in public health can be kind of undertaken in many different sectors. So it's not just NHS. You can work in local authorities and also the voluntary sector. And I suppose in particular, I enjoy my role. I love the ability that I have to kind of support and influence the population to improve their health. And I really enjoy working with others who are also passionate about improving the health of the population.
Thank you, Frances. That was really interesting. So if we can hear from Diane about her career.
Thanks, Amy. So my name's Diane. Hello, everyone. I work with Frances in Public Health Scotland, and I am a learning and development manager. So I wouldn't necessarily call myself a trainer. I don't actually deliver a lot of training, but sometimes I do need to. My role was generally office-based. I'd spend time working with a whole range of people in different organisations, as Frances has just said, looking at how we can develop the public health workforce across Scotland. So those people might work for the NHS, they might work for a local authority, and they might work in the voluntary sector. I'm often trying to understand their view of a problem and how we might work with the staff. Some of them are directly employed, some of them are volunteers, how we might work with those people to solve the problems, what skills and knowledge might they need to move forward on a project. So that's what I'm spending most of my time doing. It's around trying to influence people, organisations and policy. And often I have no power to do that. I'm not their boss. I can't tell them to do anything. I'm really just trying to work with them to bring about a solution. So as I said, that doesn't actually mean me standing up and training or teaching anything. I'm rarely an expert, but I will be working to try and create an environment where the adults can learn and develop skills and knowledge safely. So before COVID, I was working with looking at how early careers in public health come about, how do we attract young professionals into public health, and this has got a particular resonance for me. If I tell you my background, as you could see, compared to Frances, I think I'm even less conventional in my career path. So I left school and went to university and obtained a degree in zoology. I then worked and lived on a bird sanctuary in the Seychelles for a year doing ecology work, but that was mainly voluntary. I got paid very, very little, and I needed a job which was actually going to pay me money so that I could live. So I retrained as a financial advisor and then worked in recruitment in the private sector for over 10 years. Redundancy was, although devastating at the time, actually was a real opportunity for me to refocus and to find a career that I actually was passionate about. I started work for NHS Lothian, using my recruitment background and also my love for people development. I then managed to secure a role in public health at the time, that's NHS Health Scotland, and that was 12 years ago, and I really haven't looked back since. I realised quite quickly that actually this was the sector and the role that I'd probably been seeking as a school leaver but didn't know existed. When I was in school, I was fascinated by biology, hence my degree in zoology, but at the time I was also fascinated by health and what we could do to improve health, but I didn't want to be a doctor or a nurse. And so at the time, I just, the things like my world of work didn't exist back in the dark ages. So it's wonderful that these opportunities are now here. Since joining Public Health Scotland, and just about 18 months ago, I completed my master's degree. Mine is in public administration, which is focusing on the leadership and public sector side of management. It's a slightly different focus from Francis, but again, still completed as a mature student with partial funding from my employer, although I did have to do it in my own time. So that was all before COVID. Since COVID came along, I've been deployed to work in the National Contact Tracing Centre as part of the Test and Protect programme, where I'm responsible for the onboarding and induction for around 1,200 contact tracers that we have recruited since June. So yes, quite unconventional, I think you would agree, Amy.
Yeah, but there's nothing wrong with that. It's quite good to have two different sort of pathways into similar roles, I find. So we've got a few questions coming in. I'm going to stick with you, Diane, for the first one, considering, you know, a main part of your role is dealing with early careers and entries into public health. So someone is asking, do I need to go to university to get into this type of work?
Well, I think it depends where you want to end up. And Francis and I have both been to university and have both done our master's degrees as adult mature learners, and that's fairly typical where we work in public health professional roles. But public health has got a really wide range of roles. So, for example, you might work for a local authority, as Francis was saying, working with communities, people who are perhaps health coaches or football coaches. We would consider them part of the public health workforce, although they are a wider public health workforce and they perhaps wouldn't state themselves as being that. Much like the people who work in a gym, yes, their primary focus is to help you get fit, but we would consider them to be part of a public health workforce. So whilst it's not essential, and there in the NHS in particular, there are a number of modern apprenticeship opportunities which I'm aware of in the NHS. I think those do exist within the local authorities as well, but not my area of expertise. So if you wish to keep going up the career ladder, then you probably do need a degree of some sort in the long term, but not necessarily to start out.
That's perfect. Thank you, Diane. So we'll move on to Francis for a question. So what is the most difficult part of your job?
So I think the most difficult part, as Diane has kind of alluded, quite often we don't line manage the people that we're hoping to encourage to make changes. So I think change is kind of probably one of the most challenging parts in influencing people to make some changes. So often people maybe are unsure about making a change in terms of health, maybe don't have the right circumstances, maybe are in a different position. But I suppose it's about looking at how we can support them and help them to see what the change could mean for them. So I suppose, in terms of any health improvement role, public health role, it's about supporting those people to see the change that they might want to make, and to look at supporting them as best we can with that. I think sometimes the role requires a lot of skills of influencing and to encourage people. And they're all skills that I suppose you can gain through the role, but also, any skills that you gain through school, where you're in that kind of facilitating and supporting role, are beneficial. So I think that's probably one of the most challenging elements, in particular around school meals. Obviously, some of the work around that was looking at how we change people's understanding of food and the school meals that are provided in a setting. And that was very challenging because obviously there was a lot of concern about that from all different people involved in that process. So that was a challenging time. And I think with anything, there's elements of roles that where change is involved, it's a challenge for people, because people generally, some people like change, but quite a lot of people don't.
Yeah, I can imagine it might be quite hard to convince people to change their mindset or their habits and things like that. So we'll sort of ask you the flip side of the question, Frances, and we'll ask Diane the same after. So what is the most enjoyable part of your job then?
So I think the most enjoyable part, I really enjoy working with people. It's always been something that I've wanted to do. I was always keen on getting into a career, some kind of medical based work, but I didn't really necessarily want to work in a hospital. So I was very keen that I could do something to support people maybe before they got sick, and to encourage them to take on healthy lifestyles. So for me, it's very much about working with the people. I really enjoy that element. And I think working with people who are also passionate about that is really lovely and refreshing. And I think we're all trying to support each other to make a healthier Scotland, which is great.
Perfect. And Diane, is your favourite part of the job the same as Frances, or do you enjoy something else?
No, I would say very similar to Frances. I love the variety. Nothing is ever the same. Much like Frances, I love working with people who are really passionate about improving the health of Scotland, and the commitment that everybody shares is amazing. Very few of us go to work just to tick the time off. I really enjoy the fact that nothing is ever the same. It's really, there's no right answer in my job. And whilst that can be incredibly confusing at times, I think it's also a reflection on the real world, that there's no right or wrong answer in public health. We don't know for certain. So a lot of it is around trying something out and then building an evidence base that this actually works. So yeah, the easy answer is the variety and then the unpredictableness of it all.
Perfect. So we'll ask you another question, Diane. What or who influenced you to seek a career within the health sector?
Oh, well, do you know, Amy, I think if I'd had something like this a little bit earlier in my career, I think I would have found public health a lot earlier. And I don't know that anything particularly inspired me. It was a job opportunity that I saw, and then I read about it, and it was working with health behaviour change and trying to support people to speak about difficult issues such as healthy weight, alcohol, smoking. And I spent a long time working on that, and that just really, really fascinated me. Once I went for the job interview, I realised that actually this is where I wanted to be. And then my head of department, and she's still my head of department now 12 years later, and she's called Wilma Reid, and she's really inspirational. She's so kind, and yet she's very, very intelligent and driven to do her job. And yeah, I still aspire to be half as good as she is, and I'm still learning heaps from her. So while she didn't inspire me to get into public health, she certainly helped inspire me since I've been here.
Oh, that's a lovely answer. I'm an intern myself, so I'm definitely inspired by my fellow co-workers to sort of strive to be better. I think it's important to always want to keep developing yourself. So I'm interested to hear, Francis, the same question, what or who inspired you?
So I suppose it's a hard one. I'm not sure anyone inspired me to take this career in particular. I think I suppose I had a real love of people and a drive to kind of make a difference to kind of people's health in society. I think I suppose some roles that I did working in the voluntary sector when I was maybe a bit younger have probably had some influence around that, in terms that I saw how important health was to all sectors of society and to everybody. And I suppose just the kind of the importance of making sure that all people have an opportunity to have a say in terms of their health and being empowered to kind of take control of their health. So I suppose that had a big influence on me, but there probably wasn't one person. You know, as Diane said, I think a lot of the people we work with are very inspiring and kind of provide opportunities to look up to and to kind of think, yes, this is the area that I should be in and want to be in. So yeah, it's good.
Perfect. Those are great answers, and I'm sure today you both have inspired some of our young people. So I'll stick with you, Francis. So one of the schools is sort of saying that they hadn't heard much of Public Health Scotland before COVID. So do you think it's becoming more prevalent, and like what are the advantages of it sort of being in the forefront of the news and things right now?
So yeah, I would definitely say Public Health Scotland has become a more noticeable organisation in the last wee while. We actually used to be different organisations, and only came about on the 1st of April was Public Health Scotland formed. So that's maybe why people have not come across the organisation before, because it's still a fairly new organisation. But we were working in different organisations and then came together as one public health body just in April. So that maybe has a reason for kind of the knowledge of the organisation. In addition, I suppose, yeah, the increase of awareness around COVID has definitely highlighted the organisation. Our colleagues in health protection part of the organisation have obviously been working on COVID, and that's been highlighted through the media. But also all of us have been involved in some way in working more recently around COVID and the different elements that that's brought. There's been a range of different roles that people have been taking forward. And I suppose, yeah, the advantage of this is that hopefully public health is more widely known about now, and the importance of public health. People are hopefully more aware of public health as a career choice and as a role in society. I think, you know, for a long time, maybe public health hasn't been as known as widely as maybe other medical careers that people can go into. But hopefully this, out of some very challenging times, hopefully it shows that what public health can do.
Yeah, I'm just going to jump in there, Francis, and say I actually have to thank COVID, because one of my roles, one of my objectives for this year was to increase the profile of public health as a career choice. Hence, we're here today. So actually, I think COVID has done that for me. So yes, I think I can put a big tick in my appraisal at the end of the year to say that I've achieved that. I'm not sure it was single-handedly, but yes, definitely.
Perfect. I think you're the first person to thank COVID for anything. So Diane, just following on from that, do you think, working in a slightly different role to Francis, do you think, are there any other advantages of this newfound awareness?
I think that overall public health, the increased agenda is really important. I think it's got people thinking about their health, the factors the increased risk factors that have been widely reported in the media. So if you're overweight or from a Black or ethnic minority background, your risks are far greater. I think that the more people talk about these, the more aware people are of these inequalities. I think that's really, really important. Inequalities is a big piece of work for Frances and I, and many people would perhaps not have understood that in the past. And the source of those inequalities, is it simply genetics, or actually is it a set of circumstances which you're born into and live in, which actually increase your risk of certain health conditions? So yeah, I think, yeah, I would just agree that, yeah, the increased awareness of public health is a good thing.
Yeah, I agree. So for anyone now considering to pursue a career in public health or the health sector, what subjects would you recommend that they do at school?
I would suggest certainly science, having an analytical brain, somebody who's very interested in evidence and information. So if you don't know something and you're curious about something and you're inclined to go and find out about it, I think that's really important. So for me, that sort of focuses on the science type subjects. I personally wasn't very good at English, but being able to express myself verbally and written is really important. So obviously English in there is really valuable. And I think the humanitarian subjects, particularly if you're interested in public health, so things like the geography, humanities, these sorts of side of the subject matters in school would definitely stand you in good stead.
Excellent, thank you. And Frances, do you think any other subjects would be good to take, or any sort of extracurriculars or anything like that?
Yeah, I suppose I think something around kind of people skills, so skills around kind of influencing people, skills around kind of inspiring people, working as a team, and probably organizational skills are really critical. So a lot of my roles have been involving kind of a project, and it's got different elements to it, and it's about, I suppose, organising that and managing time and risk factors in that. So those elements are probably really important, as well as kind of the communication stuff that Diane's mentioned and the kind of analytical. I would say, I suppose, I didn't have a very analytical brain. I enjoyed biology and some science subjects, but didn't really have a very analytical brain, and I suppose much more kind of enjoy the interaction with people and looking at how to support them. So I think all of those elements are really important. And where possible, getting experience volunteering is always a really good way to get other skills and understanding. There's lots of different voluntary organisations across Scotland working in and around the health area, and very much supporting them and understanding what they do would be a really helpful way to gain more experience.
That's perfect, and I totally understand about not having the analytical mind, because I did genetics, but I'm much more a people person like yourself, so I went into communication rather than lab work. So just touching on something you spoke about there at the end, we do actually have a question asking, how could I get experience to help with my CV, and are there any volunteering opportunities? So could you maybe delve into that a little bit more, Frances?
Yeah, absolutely. So I suppose with any kind of opportunities, it would be dependent on where you're based and how far you're wanting to travel. But there are a number of volunteering organisations across Scotland. Again, maybe just looking at Volunteer Scotland, I think, is the organisation that has a list of all the different voluntary organisations that are in different locations. And again, searching for those that maybe are linked to health or health improvement would be a really good opportunity. I know I have volunteered in some different organisations. One was around health in a local community, so it had a food co-op where it supplied fruit and veg to the local community, and also then helped to provide walking groups and exercise for the different residents in that community. I've also been involved in other ones where I've sat on, I suppose, a board and kind of made strategic decisions for that organisation. So anything like that where you can gain skills and experience would be really beneficial.
Excellent. Thank you, Frances, for all those different examples as well. I'm sure those will be very useful for our young people today. Diane, do you have anything to add, for maybe something more like to your role, if there's any volunteering opportunities or work experience our young people could get?
I think Frances has said you probably best look at Volunteer Scotland. For me, being comfortable with people, being around people, I do volunteer as well, but my volunteering, excuse me, is more in a sports background. Sorry, excuse me, I lost my voice. Yes, in a sports background, looking at delivering coaching sessions. So there's lots of really valuable experience for young coaches in sport. And then that gets you comfortable talking to people, helping people, supporting people, and you are promoting health at the same time. So that's my volunteering background.
That's perfect. So if you're in a school club, a sports club, you can transfer those skills. I think that's an excellent message. Thank you, Diane. So I'll move on to Frances so Diane can get some more water. Frances, what is a typical day-to-day like? You can do sort of a pre-COVID and now. I think that'd be very interesting.
Okay, that's fine. So I suppose pre-COVID, a typical day would be arrive at the office. Meet up with different people. So probably a variety of meetings. It could be that I'm reviewing resources. It could be that I'm chairing a national meeting, networking meeting, so that we're sharing practice of what different boards are doing across Scotland, NHS boards are doing across Scotland. And it could also involve, I suppose, meeting with colleagues to discuss elements of my work that they're maybe involved in, and going out to visit a project as well. So quite often it would be going out to visit a certain community organisation, doing food and health work. So that was very interesting. So that was kind of, I suppose, pre-COVID. I suppose since COVID, very much has been a lot of meetings virtually, and I suppose report writing as well, elements like that. My role more recently has been looking at kind of the information that we're providing to people around the vaccine work and the flu side of things. So that's been very much reviewing resources and commenting and or linking up with other organisations externally who can also provide some support around that.
Perfect. And Diane, what's a typical day-to-day like in your job?
Thanks, Amy. Yeah, so much like Frances, pre-COVID, I would go into the office, emails, inquiries, and then trying to forge relationships and trying to link in with partnership organisations, find out where they're at, what issues they might be having, and what a solution might look like. So meetings, collaboration with people, I think that's one of the buzzwords is collaboration, but definitely working in partnership. As I said, my role doesn't come with any power. I can't tell anybody what to do. So I have to very much work alongside people to bring about change. One of the things that I miss about the current situation is those conversations you have in the office. We have a communal kitchen in the office, and quite often I'd be in the kitchen, oh hi, how are you, what are you up to? And then that would often lead to sort of my next piece of work, if you like. And obviously those conversations, those drop-in conversations, or I think they're nicknamed water cooler conversations, aren't really happening. So I would actually say that's one of the things I really miss about the current situation. So now, much like everybody, I'm working from home. I haven't set foot in the office since March. So that's a really strange situation for us. Now my typical day-to-day is lots of Zoom meetings, and since I started working on the National Contact Tracing Centre work, much of that is around troubleshooting. What's the latest problem? How can we overcome that? Supporting, I have a large team of facilitators who are delivering the training. Everything is so incredibly fast, and we don't have the time that we perhaps would have done in the past. So one of the big differences for me is we previously would have had such a huge focus on quality, and we would have been taking a great deal of time to make sure that our resources were of the appropriate quality. Whereas sometimes I now need to compromise on that in order to get something done quickly. So some of the learning and development work that we're delivering now isn't the best, and I'm not terribly proud of the quality, but what I am incredibly proud of is the speed at which we've managed to turn it around and onboard 1,200 people in a matter of months. So yeah, it's a very different working world for us right now.
It must be, but it also must be hugely rewarding, and you are both doing such an excellent job, so we do appreciate it. So we have time for one more question, so I'll ask you both the same question. We'll stay with Diane first. What advice would you give to any of our young people today if they were thinking about pursuing a career in public health or in the health sector?
I think it's probably quite general. Follow your instincts. If you're interested in a subject and you are curious about something, then you're probably going to find an enjoyable career in it. I think don't get too hung up on knowing exactly what you want to do right at this very moment in time. It might come later, but I think that for people who know that they want to follow a career in public health, I would suggest to them try and get good grades in school, particularly around those science and analytical, work on your people skills, perhaps do a volunteering role, and if it's within your grasp, I would try and go on to some further education. University would be wonderful. There are lots of associated degrees available in public health, and that will certainly help you then get the next step into the job and to move up that career ladder if that's the way you're focused.
Perfect. And Francis, do you have any words of wisdom or any other pieces of advice for our young people?
I think it would just be, similar to Diane, probably try and get as much experience as you can and speak to different people, get their views on, public health and what they think about it. But similar to Diane, I suppose just, gaining those skills and experience will hold you in really good stead in terms of moving forward with your career.
Perfect. Thank you, Francis. And I'm afraid that's all the time we have for questions. I'm just going to do a quick wrap up, and I'm sorry if we didn't answer all of your questions, but thank you so much for listening and for participating in today's session. I'd also like to thank our experts for taking the time to talk with you today and to also provide such a great insight into their careers. If you're interested in any of the careers spoken about today or any other job profiles you'd like to take a look at, such as the ones on the screen, you can head to www.myworldofwork.co.uk, where there is lots of information, guidance, job profiles and strengths and exploration tools so that you can identify your own skills. You can also speak to your career school advisor. They can provide you with any other guidance needed. If you're interested in apprenticeships, you can head over to www.apprenticeships.scot, where you'll find information on all apprenticeships, whether that's modern, foundation or graduate. There is one there that is a modern apprenticeship in healthcare support. That sounds very interesting if you're interested in these careers. I'd also like to remind you that this session will be uploaded to our YouTube channel. The YouTube channel is My World of Work. This is the last session of the year, So I'd like to thank you very much for joining. There are those links in the Q&A box for Volunteer Scotland and also Public Health Scotland if you'd like to check those out. So thank you and have a good day.